We'll talk now to the president of an organization that provides funding and technical support to organizations in Africa, Asia, Latin America, and the Middle East to secure access to safe and legal abortion, also works to end child marriage, provide comprehensive sex education, and generally build what they call safe communities for women and girls. Francoise Girard is president of the International Women's Health Coalition. Thank you so much for joining us, Ms. Girard. Welcome to WNYC.
Thank you. It's a pleasure to be here.
Your website says people will die as a result of this rule, that there will be an increase in unintended pregnancies as well, unsafe abortions, and maternal and newborn deaths worldwide. Why would no U.S. abortion funding cause women or newborns to die?
Well, because this is much broader, and you suggested that it was equivalent to the Hyde Amendment, that it just ensured that no U.S. funding would go to pay for abortion services. But as you noted earlier, it's much broader than that. What it does is basically tie all U.S. funding, and now Trump has expanded it to all global health assistance provided by the U.S. government. So we're talking now about HIV funding, malaria, tuberculosis, child health, maternal health, contraception, which is up to possibly $10 billion a year, is now covered by this global gag rule. And what that means is that organizations that receive money for any of these non-abortion related health services will no longer be able, with their own money, other funds that they receive from other donors or that they've raised locally, will no longer be able to counsel women on their options, even have a pamphlet in the waiting room that explains what safe abortion is and where they can get it. And as you noted, that's true even in countries where abortion has been liberalized. So it's a very, very broad policy now that really seeks to affect the work of these organizations, the whole of the work of these organizations, gag them, silence them, prevent them from really speaking in the consultation room with the women about their full options in an open way without fearing an investigation by the U.S. government. And outside, it also prevents these organizations, when they're meeting their local government officials, to say, we're observing that restrictive abortion laws are really causing harm, and and use their experience to persuade lawmakers to change the laws. They no longer will be able to do that if they accept U.S. funding. So that's the mechanism, and that will affect potentially millions of people, because right now, just on HIV, U.S. government funding through the PEPFAR, the President's Plan for AIDS Relief, supports 12 million people. The expanded executive order states that this will apply to all global health assistance from all departments and agencies. Previously, under Bush and Reagan, it only applied to one account, which was the family planning account, which is $600 million right now. So it was groups receiving money for family planning, contraception specifically. Now it's all global health. So that's PEPFAR, all the HIV funding, which is now at $6.8 billion a year. And it's other health funding, tuberculosis, malaria, child health, newborn health, maternal health, delivery care. I mean, it covers potentially up to $10 billion a year of funding.
Tell us more about PEPFAR, for people who don't know that acronym. What is PEPFAR, and what does it do, and how would abortion come into play in provision of HIV services?
Right. So it's the Presidential Emergency Plan for AIDS relief, HIV/AIDS relief. It was actually instituted by President George W. Bush in 2003 with bipartisan support to address the catastrophe that is and was HIV in sub-Saharan Africa in particular. That was the initial focus. Now it funds HIV programs in many more countries, up to 60 countries. It provides antiretroviral treatment, but also prevention services. And I'll give you an example. One of the key things that's been done with PEPFAR money has been prevention of mother-to-child transmission of HIV. So when women are pregnant, unless they receive care, if they are HIV positive, they're very likely to transmit HIV to their newborn at birth. So in order to prevent mother-to-child transmission, you have to do a number of things. One of them is contraception, because if you have fewer unwanted pregnancies, you have fewer women giving birth to children and passing HIV. So that's one of the pillars of prevention of mother-to-child transmission. Now, if you're saying to organizations, the organizations that are really skilled at providing contraception and services and counseling, if you take our money, you may not talk at all about abortion. You may not refer women for safe abortion. You may not counsel them in any way. You're telling them they cannot provide comprehensive health care, and if the woman would like an abortion, she may not receive the information from you. You're silencing the doctors and the nurses in the consultation room. You're really affecting the practice of medicine, and you're affecting the freedom of speech of the medical profession. So that's how it would work, and that's very damaging, because it will force organizations that are doing this right now, they're going to have to choose. Either they take U.S. government money and stop providing comprehensive health care to these women, or they're going to take U.S. money and possibly forego other funding they have to provide comprehensive care. There are other donors, European donors or other sources of funding, are giving them money for comprehensive care, so they can't keep both sources of funding, and that means their operations will be reduced and fewer women will be served. So that's the impact.
Right, and that's another new aspect of the Trump version compared to the Bush and Reagan versions that we should make very clear, if I understand it correctly. For the first time, women's health organizations around the world will not even be able to accept funding from any other source, like European aid, if they provide abortions or information about abortions in order to get U.S. funding.
Correct. It conditions all the funding, so it affects the funding of other donors as well. For example, we have a partner in Western Kenya. Currently, they're really concerned. They currently receive $200,000 a year to train doctors in the use of methods to prevent postpartum hemorrhage, which is, dangerous bleeding after childbirth. And also, they receive significant European and other funding to provide safe abortion counseling, which is very needed in Western Kenya, because there are very high rates of maternal mortality. Women die in childbirth at great rates, including because of unsafe abortions. And so now they have to choose. Either they keep their European funding and provide the full package of care, or they take U.S. funding to train doctors on postpartum hemorrhage, but they can't do both. That means they're going to lose money, and their operations will be affected in a place where they're the main provider and a truly respected provider. So that is just catastrophic.
That's why you say women may die as a result of this policy.
That's exactly right.